I love being a nurse, but I don't want to stop where nursing already makes a difference. I want to make an even bigger difference if I can. This is why I chose to become a nurse practitioner. I want to be able to serve my patients even more than I do now. More specifically, I want to be a family nurse practitioner working in primary care because you have the opportunity to be a resource for helping patients build healthy routines, prevent problems early, and ultimately lead healthy, fulfilling lives. This is why I'm drawn to the NP role, so that I can bring advanced nursing care into the day-to-day work of assessment, prevention, and long-term health management. What is a nurse practitioner? Well, a nurse practitioner is a registered nurse who completes advanced education either at a master's or doctoral level. They are trained to provide comprehensive health care. For example, in primary care, that means assessing patients, diagnosing common conditions, ordering and interpreting tests, and managing treatment plans. And then, depending on state regulations, NPs can also prescribe medications. The role of NP is rooted in the nursing model, meaning that we see patients holistically. Currently, 28 out of the 50 states allow full practice authority, which means that NPs can practice independently and not under the supervision of a physician. A commonly asked question is, what is the difference between a nurse practitioner and a physician's assistant? A physician's assistant, or PA, is also an advanced practice provider who typically holds a master's degree in physician assistant studies, and they usually complete around 2,000 hours of supervised clinical practice. They can diagnose, create treatment plans, and prescribe under the supervision of a physician. They're educated within a medical model framework, just like physicians, and they're commonly trained closely with physicians. NPs come from the nursing approach, where holistic assessment and planning are core to how the care is delivered. While NPs can open independent practices in many states, most PAs work under the supervision of a physician. However, a growing number of states are starting to move away from those supervisory requirements. Both PAs and NPs can work in a variety of healthcare settings, from primary care all the way to specialties. How about the difference between a nurse practitioner and a physician? Physicians are extensively trained through medical school and residency, and therefore they practice at a high level across many types of practices. The main difference is, of course, the foundation and pathway. Physicians are trained via a medical education model, which typically includes 4 years of medical school plus a 3 to 7 year residency program. This adds up to, on average, 12,000 to 16,000 hours of clinical training. NPs are trained through nursing licensure and then advanced practice nursing education up to a doctoral degree. NPs don't have a residency requirement, but we do complete around 500 to 720 hours of clinical training. Now, many people ask, why not just become a physician? This is, of course, an option, but for me, becoming an NP is about gaining more autonomy while staying grounded in that nursing model that I was taught and love. As a nurse, I've already seen how holistic care makes a difference in patients' lives when we take into account not just their medications, but their mobility, nutrition, mental health, stress, and support system, and not just the one body part or symptom that brought them in that day. Going back for my NP gives me the chance to do this at a higher level. NPs, PAs, and physicians are all integral members of the healthcare team. NPs are advanced practice nurses. PAs are also advanced providers with just different foundational training, and physicians follow that medical school and residency pathway. But we all work together towards the same goal on the same healthcare team. Ultimately, my reason for pursuing NP is to provide patient-centered, holistic care with autonomy and advanced scope, which comes with the NP role. Thank you.